This video is about adrenergic drugs part 2. So this is the structure of methyl dopa, and it is that considered as a derivative of alanine. See, this particular carbon is considered as second carbon of alanine, and this is first carbon of alanine. So what is alanine? It is an amino acid, NH2 group, COOH group is there. NH2 group and COOH group is there, and it is having the first position. We have the substitution 3,4 dihydroxyphenyl. At the first position we have 3,4 dihydroxyphenyl. This is the third position and this is the fourth position. 3,4 dihydroxyphenyl, and at the second position we have the methyl group. So 3,4 dihydroxy, 2 methyl alanine. So the first position is having 3,4 dihydroxyphenyl alanine. Sometimes it is also called as tyrosine. As per your previous name, it is called tyrosine. So in the tyrosine there is no OH and there is no methyl group. So when these names are given like 3 hydroxy and 2 methyl group, then tyrosine. So that is the another way of giving the name for methyl dopa. Okay. So the other name of giving chemical name of methyl dopa is based on tyrosine amino acid, and that is L-tyrosine. I have already told you the third hydroxyl group is not there in the tyrosine, and alpha methyl group is not there in the tyrosine. So these are included in the methyl dopa name as 3 hydroxy, alpha methyl, L-tyrosine. So here methyl dopa is converted to norepinephrine, and this displaces norepinephrine from the storage, thus acting as a false transmitter. It actually liberates norepinephrine from the storage, and its metabolite has alpha 2 agonist activity. It decreases blood pressure, therefore it is useful in hypotension due to pregnancy. Okay. Next drug is clonidine, and that we shall see here. This is the structure of clonidine, and it is having 2,6-dichloroaniline 2-imidazoline. So what is this imidazoline? This is the imidazoline part. This is the imidazoline part. Okay. Now dichloroaniline. This is second position and this is sixth position. So it is 2,6-dichloroaniline. At what position of the imidazoline? Second position. So it is second position of imidazoline is having one substitution called 2,6-dichloroaniline, then 2-imidazoline. That means this is 2-imidazoline, and that is given here. This is the chemical name for clonidine is 2,6-dichlorophenyl amino 2-imidazoline. It is having alpha 2 receptor activity in the brain, and it produces vasodilation and decreases heart rate decreases renin release. If this decreases renin release, then it decreases the blood pressure. It is acting as a sympathetic, decreases the sympathetic tone. If drug is stopped, rebound hypertension occurs because it suppresses for some time as long as the drug is present. If the drug is removed from the body, then it will give hypertension, that means the tension gets increased. Next drug we have to see is dobutamine, and its number is 7. It is having pyrocatechol moiety, and it is having substitution of para-hydroxyphenyl, then methyl propyl amino, methyl propyl amino. So this is propyl moiety 3 carbon, and we have the methyl substitution, and we have the methyl substitution and that amino group, and it is having amino group, and finally we have the ethyl substitution along with the catechol. So the name is goes like this. Okay, so we have to include the name of propyl methyl, then ethyl group, amino group, and then this catechol group. Okay, the name of the compound is given here. So it is plus or minus 4 2 3 para-hydroxyphenyl 1 methyl propyl amino ethyl, the square bracket is there, see, square bracket is there, then pyrocatechol. Okay, so in different books you will find different names, but again this is also somewhat correct because it is also from a standard book only. So don't worry about the different names given in different books. So what is its use? It is having selective beta 1 agonists. It has a weak beta 2 and alpha property, alpha agonist property, and it increases force of contraction of heart, force of contraction of heart, and increases conduction, so high dose brings about tachycardia, and beta 2 is producing, beta 2 effect producing dilation, and alpha activity produces constriction of veins. So it is somewhat balanced. So the output is increased cardiac output, myocardial infarction, congestive heart failure, and decreases pulmonary pressure, increases urinary output, and in hypovolumic shock, and half-life is just 2 minutes. See, half-life is 2 minutes. So given continuously. So given continuously in intravenous injection. Okay, so these are the characters and uses of dobutamine. Next drug is isoprenaline. It is also having other name isoproterenol, isoproterenol, isoproterenol. Okay, so don't confuse with this different names, isoprenaline, isoproterenol, both are same. Okay, so again this is having benzyl alcohol character. So this they are considering it as a benzyl alcohol. So this is benzyl alcohol moiety, and we have 3,4 dihydroxy group, and we have isopropyl amine moiety, isopropyl amine substitution, and again we have extra methyl group. So these are the four different groups we have to mention in your chemical name. It is considered as a benzyl alcohol moiety. It is having substitution at third and fourth position, and it is having isopropyl amine group, and it is having one extra methyl group. See, these are the names they have to include in your chemical name of the isoprenaline. We have come to the compound. So it is isoproterenol. I have told you 3,4 dihydroxy alpha isopropyl amino, the bracket closed, methyl, square bracket closed, benzyl alcohol. It is a non-selective beta agonist, stimulates heart rate in bradycardia. Where? In bradycardia. Block of heart, Torsades pointus, and in Torsades pointus. So these are the uses of your. So this is terbutalin. This is terbutalin. So the terbutalin, as per the chemical name, it is having tertiary butyl amino group. Tertiary butyl amino group. And we have the substitution methyl, tertiary butyl amino methyl group, and it is considered as again a benzyl alcohol with 3,4 dihydroxy group. Sorry, 3,5 dihydroxy group. 3,4 means it should be very close. 1, 2, 1, 2, 3, and then 5. So this is 4. So 3,5 dihydroxy group is there. Okay, so we have to consider the four names again: the benzyl alcohol substitution, tertiary butyl amino, and then methyl group, then 3,5 dihydroxy group. So these are the naming characters you have to consider while giving the name for this. Okay. So coming to the terbutalin chemical name, alpha tertiary butyl amino methyl. See, the bracket should be closed here. It is starting here and it is closed here. Then square bracket closed. Then 3,5 dihydroxy benzyl alcohol. Okay, so it is useful in asthma, status asthmaticus, and sometimes in premature labor, and sometimes in premature labor. Next drug is the salbutamol. So this salbutamol is also called as albuterol. It is also called as albuterol. So, and it is the chemical name is given like it is having dimethyl ethyl amino, dimethyl ethyl amino methyl group, and then 4 hydroxy benzene dimethanol. Benzene dimethanol. See, this is having methanol group. Benzene dimethanol. This is the first position, and this is the third position, and this is fifth position. So fifth position, 1, 2, 3, 4, sorry, it is not fifth, it is fourth, because this is 1, this is 2, and this is 3, and this is 4. So it is the chemical name as containing uh, dimethyl ethyl amino methanol substitution at two positions of the benzene ring. Then it is hydroxyl group at the fourth position, and it is given here. So the chemical name is as follows. Okay, so it is alpha R, stereochemically important center is there, and it is alpha dash square bracket small bracket 1 dimethyl ethyl amino methyl 4 hydroxy 1 3 benzene dimethanol 1 3 benzene dimethanol. It is a strong beta 2 agonist, and it is present in airway muscle or lungs, and it increases cyclic 3,5 AMP pathway. It increases cyclic 3,5 AMP production, which is acting as the secondary messenger for the cells. So ultimately it gives relaxation of all smooth muscle, especially trachea and bronchiole. So that is why it is a very good asthmatic drug, very good asthmatic drug.